Hello, I'm Mandeep and I will be taking you over the presentation. The subject name is Transforming Destinations, and listed are my team members who have all been a part for our data collection and analysis. Our aim is to look at the current situation of health and wellness in Sooke and understand what possible improvements in those aspects can lead to a better life quality in the Sooke community. First, I'm going to talk about the SWOT analysis of Sooke to better understand the current situation. Talking about strengths, Sooke has one medical clinic named as West Coast Medical Clinic. The local government, Island Health, and the South Island Division of Family Practice are partnering to expand West Coast Family Medical Clinic. Sooke has parks and natural attractions such as French Beach Provincial Park, East Sooke Regional Park, Sooke Potholes Provincial Park, and the University of British Columbia promotes a family practice residency program in Sooke. In addition, there is Sooke Regional Communities Health Network, which has been around since 2003 to promote health and wellness to the local community. This network is supported by many volunteers who can be local residents, family doctors, or social service agencies, etc. The weakness of Sooke are that it offers only family clinics or health units. The closest hospital is in Victoria. Sooke also has an aging population, and a further decline is expected in youth population, while the senior population is expected to grow in the next couple decades. According to the available data, 67% residents in Sooke commute to work using their own vehicle, with Sooke Road as the main drive to Victoria. There has also been a surge in housing prices since 2016, which makes it difficult for physicians and their families to settle in Sooke. There have been reported delays on ambulance responses as well, which we'll discuss in depth at a later stage. Moving on, there is opportunity to take primary care network approach. Also, there are students in public health and social policy at University of Victoria, as well as nursing students in Kamosam College. So can also make use of provincial nominee program, the PNP. The place also has qualities to become a wellness destination. I will do an in-depth discussion of all these concepts after the SWOT. Talking about the threats, the attractiveness of neighbor districts is higher, and people given a chance would probably choose those areas instead of Sooke. Uh, Other threat is the natural disasters and health outbreaks such as the COVID-19. One more threat is that the provincial government is the decision maker that controls financial resources, while the local government only acts as advocacy. So this means that the effectiveness of any suggestions depends significantly on the lobbying process, and there has been hindrance in promoting Sooke as a tourist destination. Now let's discuss the issue of ambulance. There are several ambulance services in Sooke, and the most prominent among them is the BC Emergency Health Services, known as BCEHS. It is part of the Provincial Health Services Authority and has a fleet of four air ambulance helicopters, six ambulance vehicles, and one dedicated plane in Fort St. John. BCEHS provides ambulance services throughout the province of British Columbia. The ambulance service is responsible for patients' care delivery as well as patients' care communication, planning, and dispatch. Despite the several ambulance services available to Sooke, there are complaints that they are not enough for over 13,000 people which reside in Sooke, and the existing ones take long to respond. To prove this statement true, there is an open letter regarding ambulance services by Sterling, who claimed that it took 45 minutes to get an ambulance, and by that time he had recovered and was given an all clear response. In addition to lower response time, some other challenges include slow ground ambulance over long distances, long wait for transfer from smaller to bigger hospitals, and paramedics who have advanced training. Also, there are claims of gaps in the provision of emergency medical services between people in rural parts of the province and the cities. Now, let's discuss the potential or the opportunities. So, the first one, as mentioned earlier, Sooke can make use of the provincial nominee program. The British Columbia PNP provides a platform for the high demand for foreign workers and business professionals to obtain permanent residency in the BC. And this can help Sooke to invite skilled medical practitioners to come and work in this region. The only challenge here is the requirements for foreign physicians to practice in Sooke, and having a medical facility can help with attracting professionals from the stream. The second one is the primary care network. So, with a team-based approach, it is a promising one to healthcare issues in Sooke. Our primary care network aims to provide a network of physicians and other providers in a defined geographic area. Electronic medical records of all the patients are shared for easy and on-time access in the network, and patients will not have to wait for one specific doctor to be available. Instead, any available physician in the network who is appropriate can provide timely, coordinated, and comprehensive health support. The challenge for Sook is to make it more attractive than the other districts in the Greater Victoria, so that physicians will choose Sook over the others. Two areas Sook can develop to overcome this challenge are building a professional medical facility and creating a dynamic community. Now, a dynamic community confirms that the uh, place and equipment to provide excellent care for patients. Sorry. A dynamic community confirms that the physicians and their family can settle in Souk and have better living conditions. On the other hand, a professional medical facility will ensure that physicians will have the place and equipment to provide excellent care for patients. And as discussed, having a medical facility will help Souk look more attractive to the students to choose Souk for their practicum and assist with meeting the requirement for practicums employers. The third potential is promoting Souk as a wellness tourism destination. With the increasing attention to health, the popularity of wellness tourism has been growing all over the world. The existing wellness infrastructure in Souk can be divided into four categories, focusing on physical, mental, environmental, and social aspects. Now, the primary healthcare services group and improved medical services have been trying to provide a positive physical foundation to residents and tourists. Additionally, there are a variety of spas, yoga studios, weight management organizations which facilitate people to achieve a healthy mental level. Referring to the support from District of Sooke, a survey focusing on mental health services in Sooke has been launched and analyzed by the team from Sooke Region Communities Health Network. The purpose is to look for the gaps in current services and think about solution to take care of residents' mental health. In the environmental aspect, the pretty natural resources in Sook offer great parks, beaches, lakes, and trails for outdoor activities such as hiking, fishing, boating, and so on. Since the marketing trend on wellness tourism shows potential uh, economic benefits, if Sook can use its existing resources to increase the quality of local life and attract extra tourists, it may gain sustainable development in a positive cycle. And now Sue can refer to this model. It's from Global Wellness Institute, and then it can adjust as needed when they develop wellness for the local community. The model displays the various positive aspects of wellness tourism, such as mental, spiritual, emotional, environmental, social, and physical, further subcategorizing them into the facilities and activities which promote the same. Finally, I would conclude the presentation by putting 3 points forward. Firstly, focusing on opportunities. The District of Sooke can choose to focus on one opportunity at a time, or maybe on all of them simultaneously, depending on the allowed budget and human resource. Secondly, the health and wellness in Sooke need more attention and investment. Moreover, health and wellness are mandatory to unfold the potential of tourism in Sooke. And thirdly, by embracing the suggestions, Sook can be better prepared for the future, especially for the unprecedented events like the current COVID-19 pandemic, which has taken the world by surprise. If Sook can show everyone that it is ready to make positive changes and be ready to tackle the health and wellness issues of the locals and tourists, it may lead to growth and development of the Sook community. Uh, Thank you.